back. The Ford government says 9 supervised consumption sites will close as planned today.
Now, the Office of the Health Minister says the 9 sites that applied for funding to transition into homelessness and addiction recovery treatment hubs, or HEART hubs, are proceeding with those plans. Now, one consumption site in Kensington Market is choosing to remain open after an Ontario court granted an injunction allowing it to temporarily continue operating. The sites were ordered closed, though, under new legislation because they were deemed too close to schools or daycares. The province is investing more than $500 million creating these so-called HEART hubs, shifting away from a harm reduction approach to an abstinence and recovery-based model.
So joining us live now for more on the new Ontario HEART hubs is Robin Giller, the Executive Director of St. Michael's Homes and the co-lead of the East Toronto HEART Hub. Good morning, Robin. Thank you so much for joining us. So we have the provincial government investing about $550 million to create these 28 new HEART hubs. Talk about what's going to be offered at your East Toronto HEART Hub and whether or not you think this can really curb overdoses. We know that, in 2023, there were 2,600 overdoses, and that these safe consumption sites prevented more than 20,000.
Yeah, so the East Toronto HEART Hub, which is a partnership of 14 organizations led by South Riverdale Community Health Centre and St. Michael's Homes, will provide a broad range of services, including access to primary care, case management, addiction and mental health counseling, Indigenous specialized supports through 2 of our partners, and access to housing and treatment beds as needed. And I guess I've been telling the Ministry of Health for about 10 years that there's a huge gap in our healthcare system. If you think about if you have a physical health issue, you have a home, right? You have your family doctor, and if you're part of a family health team or CHC, you have the whole team with you. If you have a mental health problem, you may have an ACT team or a case management team that is your home. And for people who use drugs, has never been a home. What we've had is episodic care through treatment programs, through physicians, addiction medicine, physicians' offices, and so on, and no home. And so I think the HEART Hub, I'm excited about the HEART Hubs because they create those homes for people with challenges around substance use to work on making their lives better and getting supports over an extended period of time with a team-based approach with access to primary care, to psychiatry, to, all of the social supports that they need in housing. And so I'm quite excited about this. It's been a big gap in our system for a long time.
So, Robin, how do you make the switch, though, sort of, in 24 hours, going from, in one case, a safe injection to now the sort of HEART Hub style of management, et cetera here? And how much of a challenge does this pose for St. Michael's Homes?
So St. Michael's Homes does not offer safe consumption services and never has. So for us, it's pretty straightforward. Yeah. So a little bit more of a challenge for our community health center partners who are making the transition. But I think, we in South Riverdale have been preparing this for months and have been working on this for months to prepare for this. So it's not like it's actually, overnight. And so South Riverdale, their safe consumption service at their Riverdale location closed last week. And they've been preparing for this transition for a while. I think in Toronto, we're fortunate that there are a number of safe consumption sites remaining open for those service users who really need that kind of service, that part of the service. But now we're in a position to support people more effectively and for the long term. I just wish that the HEART hubs had been opened, by when the Wynne government implemented safe consumption. If they'd opened something like a HEART hub then, we'd be having a very different conversation now, I think.
Yeah, and we learned that, the past Friday, the Ontario Superior Court ruled on an injunction to keep safe consumption sites open, but only 1 out of the 10 is choosing to remain open and not getting funding from the provincial government as a result. Can you talk about the funding that each of these HEART hubs is getting, and do you think it's sufficient to help people recover from addiction?
Yeah, I mean, so I've been working in the mental health and addiction sector for about 20 years. And I would say this is one of the better resourced implementations that I've ever seen in our sector. I think that from my perspective, I asked the ministry for funding for an outpatient team that was similar to this a number of years ago, and the funding we asked for was about, a quarter or a third of what each heart hub is receiving. So from my perspective, they are robust resources. They will allow us to make really significant impacts on people's lives, and I'm really looking forward to it. The one thing that will be a limit, I think, is the volume of housing units that will be available in the heart hubs is good, but it's not going to meet the full demand, right? I mean, it's a limited number of units, and so we're going to have to do significant work. And we're working on some creative solutions to access additional housing units as part of the implementation.
I'm sure you are. Okay, well, you got some important days ahead. Appreciate the time and perspective this morning. Robin Giller from St. Michael's Homes, thanks for being here.
Thank you.
Thank you very much. Have a great day.